Hey everyone, welcome back to the channel. Today, we're diving deep into one of the most widely prescribed medications on the planet, Atorvastatin. You might know it by its brand name, Lipitor. What exactly does it do? Who should be taking it? And what are the important things you need to be aware of? We're going to break it all down in a simple, easy to understand way. So, if you or someone you know takes this medicine, or if you're just curious about how it works, you're in the right place. Let's get started. First things first, what is atorvastatin? Belongs to a class of drugs called statins. Think of statins as the managers of your body's cholesterol factory, which is primarily your liver. Their main job is to reduce the amount of cholesterol your liver produces. While you might be familiar with the brand name Lipitor, the generic version Atorvastatin is incredibly common and works in the exact same way. It's a cornerstone medication for managing cholesterol levels and protecting heart health for millions of people worldwide. So, why would a doctor prescribe atorvastatin? Its uses are quite specific and incredibly important for cardiovascular health. The primary goal is to manage your cholesterol profile. This means it's used for lowering bad cholesterol, which is known as LDL cholesterol. LDL is the type that can build up in your arteries and form plaque. At the same time, it can help raise your good cholesterol, or HDL cholesterol. HDL acts like a scavenger, helping to remove cholesterol from your arteries. Atorvastatin also helps reduce triglycerides, another type of fat in your blood that can increase your risk of heart disease. Ultimately, the goal isn't just about numbers on a lab report. By managing these fats, atorvastatin plays a crucial role in preventing major cardiovascular events like heart attacks and strokes. It's often prescribed for people who have already had one of these events to prevent another, or for those who are at high risk. This includes people with diabetes, as they often have cholesterol issues that increase their heart risk. Doctors typically turn to medications like atorvastatin when lifestyle changes, such as improving your diet and getting regular exercise, haven't been enough to bring your cholesterol levels into a healthy range. It's a powerful tool to supplement those healthy habits. Now, let's talk about the science behind it. How does atorvastatin actually work its magic? The process is quite fascinating and centers on the liver. Your liver contains an enzyme called HMG-CoA reductase. This enzyme is a key player in the assembly line that produces cholesterol. Atorvastatin works by blocking this enzyme. When the enzyme is blocked, the cholesterol production line slows down significantly. In response to lower cholesterol production, the liver starts to pull more LDL cholesterol out of your bloodstream to meet its needs. This dual action, reducing production and increasing clearance from the blood, is what makes statins so effective at lowering overall LDL levels and reducing the risk of plaque buildup in your arteries. So, what are the tangible benefits of taking AT? The advantages are significant and can be life-changing for many people. The number one benefit is the prevention of heart attacks and strokes. By lowering bad cholesterol, it directly reduces the material that builds up as plaque in your arteries, a condition known as atherosclerosis. Less plaque means wider, healthier arteries and a lower chance of a blockage that could lead to a heart attack or stroke. This contributes to better long-term heart health and can add years to your life. From a practical standpoint, atorvastatin is usually taken just once a day, which makes it very easy to stick with the treatment plan. It's simple and convenient. Plus, it's effective even at low doses for many patients, which can help minimize the potential for side effects while still providing powerful protection for your heart. Of course, like any medication, atorvastatin can have side effects. It's important to be aware of them, not to be scared, but to be informed. The good news is that most people tolerate it very well, and when side effects do occur, they are often mild and manageable. The most commonly reported side effects include muscle pain or weakness. This can feel like a dull ache or soreness, similar to what you might feel after a workout. Some people might also experience headaches, stomach discomfort, diarrhea, or constipation. These issues are often temporary and can sometimes resolve on their own as your body gets used to the medication. However, there are also some less common but more serious side effects that you absolutely need to watch out for. Although very rare, a severe form of muscle breakdown can occur. This is a medical emergency. Also, changes in liver function can happen, which is why your doctor will monitor your liver with blood tests. Some key warning signs to look for are severe or unexplained muscle pain and weakness, unusual fatigue that doesn't go away, dark-colored urine, or jaundice, which is a yellowing of the skin or the whites of your eyes. If you experience any of these serious symptoms, it's crucial to stop taking the medication and contact your doctor immediately. Open communication with your healthcare provider is key to using this medication safely and effectively. Now, let's discuss who should not take atorvastatin, or at least should be very cautious. This medication isn't suitable for everyone. For example, people with active or chronic liver disease may not be good candidates, since the drug is primarily processed by the liver. It's also not recommended for women who are pregnant, planning to become pregnant, or are breastfeeding due to potential risks to the developing baby. Individuals who consume heavy amounts of alcohol should also be cautious, as this can increase the risk of liver problems when combined with a spittoon. Furthermore, atorvastatin can interact with other medications. Certain antibiotics, antifungal drugs, and even some other cholesterol medications can affect how atorvastatin is processed in your body, potentially increasing the risk of side effects. This is why it's so important to give your doctor and pharmacist a complete list of all the medications, supplements, and even herbal products you are taking. The bottom line is to always have a thorough discussion with your doctor before starting or stopping atorvastatin. Self-prescribing or stopping on your own can be dangerous. To wrap things up, let's go over some practical tips for using atorvastatin safely and getting the best possible results. First, consistency is key. Try to take your pill at the same time every day. This helps maintain a stable level of the medication in your body. Whether you take it in the morning or at night usually doesn't matter. Just pick a time that works for you and stick to it. Second, it's wise to avoid excessive alcohol consumption. While a drink here and there is generally okay for most people, heavy drinking can put extra strain on your liver. Your doctor will likely recommend periodic blood tests, especially when you first start the medication, to check on your liver function and cholesterol levels. Make sure you get these tests done as recommended. Remember, Atorvastatin is a tool, not a magic pill. It works best when combined with a healthy lifestyle. This means following a heart-healthy diet that's low in saturated and trans fats, getting regular exercise, and not smoking. And finally, never stop taking Atorvastatin without talking to your doctor first. Suddenly stopping can cause your cholesterol levels to rebound, potentially increasing your risk of a heart attack or stroke. And that's our comprehensive look at Atorvastatin. We've covered what it is, how it protects your heart, and the important things to keep in mind for safe use. This information is for educational purposes and should never replace advice from your healthcare provider. If you have any questions about your own health, please speak with your doctor. I hope you found this breakdown helpful and easy to follow. If you did, please give this video a thumbs up, share it with someone who might benefit. And don't forget to subscribe to the channel for more simple medical explanations. Thanks for watching, and we'll see you in the next video.